perform two different types of fetal cardiac interventions, and the first is for fetuses who have a narrowed aortic valve that look like they may develop hypoplastic left heart syndrome, which is a heart problem where the left side of the heart is underdeveloped and the right side of the heart has to do the work of two ventricles. That procedure, we open the aortic valve in the fetus to try to keep the left side of the heart pumping for the body and the left side of the heart growing normally. The second fetal cardiac intervention is performed when a fetus has hypoplastic left heart syndrome but does not have a hole between the top two chambers of the heart. When that is the case, the blood cannot get out of the left side of the heart and backs up into the lungs and causes lung damage in the fetus. So in this type of fetal intervention, we are creating a hole between the top two chambers of the heart with a balloon. In both types of fetal cardiac intervention, the procedures are performed in an operating room, and the first step of the procedure is to make sure that the fetus is in a good position for the procedure. The obstetrician can manipulate the fetus through the mother's abdomen to get the fetus into perfect position for the procedure. After that's done, general anesthesia is induced for the mother, and the procedures are all done under ultrasound guidance. Next in the procedure, the fetus is given a medicine for pain and a medicine to relax the fetus and also to make the fetus not be able to move for a brief period of time during the procedure. And that is done through a needle, through the mother's abdominal wall, through the uterus, and into the thigh muscle of the fetus. Next, the fetal intervention is started, and we take a small needle that is advanced through the mother's abdomen, all under ultrasound guidance, through the uterine wall, through the chest wall of the baby between the ribs, and into the heart. If we are performing a ballooning of the aortic valve, that needle is advanced into the left ventricle, and a wire is then manipulated across that aortic valve. And over the wire, we pass a small catheter that has a balloon on the tip of it. We put the balloon across the aortic valve and inflate the balloon, thereby enlarging the aortic valve. And then the balloon and wire and needle are all removed from the heart. In the fetal intervention, where we create a hole between the top chambers of the heart, the needle is advanced through the mother's abdominal wall, through the uterus, into the right atrium of the heart of the baby, and through that wall between the top chambers of the heart into the left side of the heart. We pass a wire out into the vein coming from the lung, and then we place a catheter that has a balloon on the tip of it over that wire, placing the balloon across the wall between the top chambers of the heart. We inflate the balloon several times, and that creates a hole between the top two chambers of the heart. The wire, catheter, and needle are then removed from the heart, and the procedure is complete. In some of the procedures, blood can collect around the heart of the fetus that needs to be drained, and we can drain that with a separate needle under ultrasound guidance, and then that needle is removed. And then we do watch the heart with ultrasound for 20 to 30 minutes in the operating room to make sure that blood doesn't recollect around the heart.